So if a patient is on semaglutide and they abruptly stop the medication, what we often see is that they get a kind of a rebound hunger. What semaglutide does is it delays gastric emptying, so you feel full much quicker. It helps with your glycemic index, so you don't have big peaks and valleys in blood sugar. And it also turns off that glucagon-like 1 peptide receptor in the brain that is responsible for food chatter and kind of that constant nagging of needing to eat. So when you abruptly stop the medication, its half-life is about a week. So after a week, the medication, is no longer in your system. Unless you've made extreme changes, likely you'll go back to old habits is most common, or you'll have an extreme amount of hunger and start eating maybe more or binging more than you were before. When our patients reach their goal on semaglutide, I will sit down with them and we'll determine, is it appropriate to stay on the dose that they're currently on? Is it appropriate for us to go down on the dose? Or is this something that we want to abruptly stop? I very rarely would recommend abruptly stopping the medication. For most of our patients, we kind of figure out what their long-term dose is and where they're able to maintain a healthy body weight for their size, where they feel comfortable and confident. And that's the dose that we recommend, which may be lifelong, and likely we will recommend lifelong treatment. There are some patients who really want to get off the medication. It may be financial reasons, or they don't want to be dependent on a medication, which we understand. What we would do in that case is just very, very slowly decrease the dose of the medication, and possibly even, trial them to where we've titrated down, we're off the medication, but we can always restart it if we need to, if they have that rebound hunger. So here at Plaza Aesthetics and Wellness, when we have patients inquire about semaglutide, we take some information over the phone. We ask them their height and weight and calculate their BMI or body mass index. With that, we're able to determine, are they an appropriate candidate? So this is not for a patient who wants to lose 5, 10, 15 pounds. This is for a patient who's obese with a BMI over 30, or we do have a small subset of patients with a BMI of 27 to 30 who have comorbid risk factors. So, and women may have polycystic ovarian syndrome. Patients could have hypertension, hyperlipidemia. We have a whole list of comorbid conditions where they could potentially qualify. But some of those, they may be good candidates, they may not. So, we're really making sure that when our patients sign up, they're good candidates. I do a comprehensive consultation. It usually lasts around 30 to 45 minutes. We discuss the risk versus benefit and determine if they're an appropriate candidate.